In a lot of ways, it doesn't really matter what size community you have. You're going to have a lot of the same characteristics in that when smoke comes into an area, it's going to affect everybody. And one of the things that I say when I'm talking about wildfire smoke and fire, because during wildfire, the flames get most of the attention. But generally, not many people are really even at risk of losing their homes to fire. Now, it certainly can happen, and we want to be conscious of that. But the number of structures lost is typically not really huge, and yet the entire community will be impacted by smoke. So it doesn't really matter if it's a large community or a small community. If people are going to be affected, they are going to be affected regardless of size of community. You're going to have people in a small community or a large community they're going to have people who are sensitive to the smoke and can be impacted by breathing in that smoke and being exposed to it for extended periods of time. And you're also going to have some folks who need some additional help. They're going to need more of a hand up than maybe the rest of the community. Now, in a smaller community, they tend to be sometimes closer to the fires. A lot of times when you have fires in the wilderness or on the outskirts of an area, that's where also the smaller communities are more likely to be. And those folks, if they're living in valley bottoms that are near fire, they can see levels of smoke that are considerably higher than what you may see further away from that, where the flames actually are. Because the smoke from that fire will just come down and settle in that small valley, and the folks that are living in it are exposed to that until the fire goes out, which sometimes means it's going to be there until it snows. So you have these small communities that are at risk of being exposed to really high concentrations for a very long period of time. And then you add in the fact that smaller communities are less likely to have the resources to cope with wildfire smoke, and they don't get as much attention provided to them. It's not as exciting when a small community of a few hundred or 1,000 folks gets smoked out as it is when a city with a couple of million people gets smoked out. So even though you have these smaller communities that may be breathing this crud for a month and just dealing with it, they don't get nearly as much attention or resources thrown at them as when you have a large city suddenly dealing with smoke. And we're not saying that the resources actually exist to help millions of people in a large city, but they certainly get a lot more attention paid to them. And then you add in yet another thing, where a small community might not have the expertise. There might not be somebody in that area that has the background and the experience in wildfire smoke and also the resources to marshal a really good response. And then you add in the fact that it can be hard to get messaging in a small community out there where Facebook from the local health department that's based many miles away, like they might have a Facebook page, but the odds that your little small community is following that health department's Facebook page, probably not great. So they need information about how to protect themselves from the smoke, but that information, if it stays centralized, is not likely to get to them. So in a small community, you need to actually go into the community and find out where they get their information. Sometimes it might be the local general store or the hardware store, and I know that in Missoula County, when we're trying to reach out to our smaller community of Seeley Lake, when people show up to a community meeting, we put posters in like the most frequented hardware/gas station in town, and then people all come to the meeting because they all go there and they see the posters and they show up at the meeting. So you need to find out where they get their information and understand it's not likely to be the same as in larger communities. So there's a lot of different peculiarities that go into a small community, but the primary takeaway, I think, is that the small communities are likely to be impacted by smoke that can be heavier than what you might see further away from the fire, and they might not have the resources to cope with it. So in a small community, you are not necessarily going to have the expertise to address wildfire smoke. A lot of times at least in the state of Montana, the public health preparedness person that is appointed in the local county health department is typically going to be a public health nurse who does not have any background in wildfire smoke or wildfire smoke response. And if it is not a public health nurse trying to do smoke response, then it may be the local emergency response staff, and they are probably going to be more able to cope with the flame part of the fire than the smoke. So you don't necessarily have people in these smaller, more rural areas with smoke experience. And that means that they are going to be more likely to need to draw upon centralized messaging coming from the state, or in Canada, the provincial, I would imagine, authorities saying, hey, this is what the air quality is like in that region, and here's some health messaging. But then the challenge is to get that message to the small community, and also see if it's even appropriate for that small community. One of the challenges that we run into is air quality monitoring might not exist in these smaller, more rural areas. You know, in Montana, we have 56 counties, and 15 of them have permanent air monitors. We can get air monitors loaned out during a wildfire from the state Department of Environmental Quality, but those monitors need a cell signal in order to let you know what the data they're collecting says, and there are a lot of areas in Montana that don't get cellular service. So it just adds to the difficulty of finding out even what the air quality is. And then, of course, you're going to have always the resource issue of, if you're going to try to respond to wildfire smoke in a proactive way, if you're going to try interventions and get portable air cleaners to the hardest hit people, that takes money. And it can be very hard to get that money. In my personal experience, trying to respond to a public health emergency from wildfire smoke in Sea Lake, Montana, that was the worst smoke we have ever seen, it was really hard. I went to the state and I asked for money, and they didn't give me any. They said, use what you've got. So we had to empty our public health emergency preparedness budget that was supposed to be for responding to the flu, and then we had to go and ask for money from nonprofits and charitable foundations, and reach out to the internet and friends and ask for money so we could make cleaner air spaces for this small community. So that's always going to be a challenge in small communities, is just a lack of resources. The worst time to respond to a disaster is while it's happening. We learned that, boy howdy did we ever learn that in 2017 when we were trying to find the resources to get portable air cleaners into elementary school classrooms in my region. We couldn't get money for it. The shipping speeds were super low. The shelves were empty. Folks going out trying to frantically find ways to create cleaner air spaces in their homes were finding empty shelves. Inventory was just gone because there were so many people frantically trying to get a way to filter their indoor air, which means the right time to prepare for a wildfire smoke season is well before it happens. This is important for public health providers to know for messaging. Get out there and hit the message hard before the smoke arrives. Encourage people to go out there and get portable air cleaners with HEPA filters in them to create a safe space in their homes. Encourage them to upgrade the filtration in their HVAC systems. If they have central air, you can actually buy a filter for your system that can remove a decent amount of fine particulate. They cost a little bit more than what people might have standard in their homes, but it is something they can do to try to have cleaner air to breathe. And if you do this preparation beforehand, you want to stock up on them. During a smoke event, you're going to need to change your filters pretty frequently. They will get full of crud. So you want to make sure that you have enough on hand to change them out more frequently than you would when the air is clean. It just kind of makes sense. It's going to get more full of particulate. You're going to want to clean that out. And one thing that we found out from having portable air cleaners in super smoky air, the HEPA filters are supposed to last for like a year, but after a month and a half of the really, really, really nasty smoke, I plugged one in when the smoke season was over, and we were checking these out and making sure they were in good shape. and the worst horrible smoky smell came pouring out of that machine. I had to throw away all of the HEPA filters that were used during that month and a half of really intense smoke. So you cannot expect the advertised lifespan of these filters to get you through a wildfire smoke season. So stock up, plan ahead, identify if you have any places in your community that has filtered air. The odds of it aren't great. The current standard for filtration, at least in the United States, for filtering in commercial buildings, it's called a MERV 8, which is a filter that's not rated to remove fine particulate matter. You don't tend to find MERV ratings that do remove fine particulate matter unless you're in a hospital or you have a forward-thinking school or other buildings that have investigated different filtration rates and realize that they need to maybe have something that is actually rated to remove fine particulate. A MERV 8 will help a bit during a wildfire season, especially if you reduce outdoor air intake and so you're recirculating air through that filter. You will still see some benefit until the smoke outside gets really, really high, and you have, especially like a long duration smoke event, eventually those MERV 8s just cannot keep up, and so you want to have a higher rated MERV filter and replace it. Keep track of how full it's getting with particulate and get a cleaner one in there so it can keep collecting all the nasty stuff in the air. You want to make sure you're recirculating your air. One of the challenges we have is a lot of HVAC systems are designed to just take outdoor air and dump it inside, because the theory is outdoor air should be better than indoor air, and most of the time that is true. That is not true during wildfire smoke season when it is just hideous outside, and most HVAC systems, if they're just dumping outside air and bringing it inside, your inside air is just the same as outside air. We have done some indoor air quality monitoring during a prolonged smoke event. And we found that the library, you might as well have been outside, the senior center, you might as well have been outside, the high school gym, you might as well have been outside. And these are places that we want to have clean air. And so the only way to have those places have clean air is to plan ahead, investigate what kind of systems you have, and then probably have to test it during a smoke season to make sure you're actually getting some effect. But if you aren't doing anything, you can't assume inside is safe. So plan ahead, get the materials that you need, get the communication out there, and also get the communication to the people who need to have it. Don't just send it out into the ether and assume that people know that you're saying good stuff. You have to find out how to communicate with the communities that you're targeting. So what you have with small communities is a pretty significant need for self-sufficiency. And I mean, the good part of that is typically culturally small communities want to be self-sufficient. It's going to vary, obviously, depending on where you are and who's in that community. But at least in Montana, a lot of our small communities, they don't really want the government or academics to come in and tell them what to do or say, we're here to help. But they do still need tools. And it's really important, if you have a small community, get to know the community. Get in there, make sure that they know who you are and that you just want to help, but find out what kind of help they need and what they want. Identify community leaders. These will be your champions in that community. I think all small communities have some people that are standout. Everybody knows who they are, and in a good way. You want to make sure that they're people who are well known in a good way. But if you can get them on your side and teach them about creating cleaner indoor air spaces, give them some tools, maybe an indoor air quality monitor so they can really see how it works and measure their indoor air quality and compare that to outdoor air, then that kind of messaging can start to move around the community. There are some lower cost particulate sensors out there. They are not fantastic yet, but they can do a decent job of at least showing the magnitude of difference in the location. So if you have one of those lower cost air quality monitors, take it outside, see what the air is like, take it inside, see if it's better or worse, and that's a teachable moment for understanding that the outdoor air does come inside. You need to look for low-cost solutions. Typically, most small communities tend to have a higher proportion of lower-income folks, so you want to try to find low-cost solutions. If that is if you're looking for a portable air cleaner, getting a smaller one that will only clean the air in a bedroom. I mean, it'd be nice to be able to protect the whole house by getting a lot of larger ones, but understanding that there are going to be some cost limitations. You can look into the DIY type of portable air cleaner where you take a box fan and put a MERV 13 HVAC filter in front of it or behind it. Look it up. I don't actually have all the knowledge on that because it's not something that I typically advertise, because if I can't from a government agency say, hey, use this box fan not according to manufacturer's the directions, but I do know that it is a less expensive method of removing fine particulate from the air that has been done in several communities and might be something worth looking into if you are interested in lower cost solutions. And then it's also important to really get good communication that is relevant for the people in that community. You know, there's some really wonderful people who don't necessarily know how to talk to the small communities or where they get their information. You can have a community that their news broadcast is from hundreds of miles away in a much larger town, and what's on that news is not going to be relevant to their lives. So you need to find out how to get them information that's relevant to their lives. And sometimes that means showing up and talk to them and get to know the folks in the small community so you can find out how they will receive messaging and figure out how to tailor the message to that community. I think that one of the important things to understand is if you're going to try to approach wildfire smoke from a public health response, don't do public health at a small community. You need to do public health with the small community. Get in there, engage with them, and build a network within that community of folks that are able to take your message and grow it. So to sum up all of that, which is way too much information, find a community leader, build a network, find low-cost solutions, get good messaging out there, and try to help that people understand their air quality either with low-cost sensors or with really getting that visibility index idea of if you can't see for 3 miles or 5 miles, the air quality is unhealthy. I think most people know that if you can see the air, it's bad air, but we all still want to have some sort of a qualifier on it, like how bad is the air? And so if you can't see for 5 miles, you know that air is unhealthy, and you know, obviously the less you see, the worse it is. The biggest challenges that I have faced came in 2017 when we were basically smacked upside the head with the worst smoke we'd ever seen. We had the Rice Ridge Fire, was a 165,000 acre fire that was right outside the town of Seeley Lake, which is a town of about 2,000 people in a very narrow, confined valley. And the smoke that poured down into that town every night was the worst smoke we had ever seen. I went into that wildfire season with my typical activities of I do wildfire smoke updates. I send them out twice a day with information to my email list and the media. This is where the fires are, this is how bad the smoke is, this is what the smoke's going to do, and here's how to protect yourself. And our public health messaging at that time was when the smoke is very unhealthy or hazardous, everybody stay inside. And that was our standard messaging. That is what we had. That's what came from the state, it's what came from the EPA, it's what we had decided, yet that's our message. And then the smoke from the Rice Ridge Fire poured into Seeley Lake, and that smoke was inside the buildings. You could see the smoke inside the elementary school. You could see it inside the health clinic. Telling people stay inside was not useful information because the smoke was inside. That was not protective health messaging. So that was horrible, and we didn't really know how to respond to that. My initial reaction was, I need to tell people to leave. Like staying there and staying inside was not protective. And so I got together with my supervisors and the physician from Seeley Lake and the health board chair and our office of emergency management and the air resource advisor from the fire. And we put together a recommendation that people try not to sleep in Seeley Lake. Because here's the thing, there was cleaner air 15 minutes away. Like you literally just had to leave the valley to get cleaner air. And that felt like the right message of just try not to sleep there. The smoke cleared out in the afternoons. It got a bit better, but overnight and in the morning, the smoke you could see for a block. Our monitor couldn't measure it. It was beyond the capacity of our monitor to measure the air, and we knew it was going to be like that every single day until it snowed. And this fire started at the end of July. So we went with that, and it turns out not the best message. Really, no one took us up on it. Some people left, but they kept coming back. I knew of an elderly couple that they had another home in a less smoky area, but they kept going back to Seeley Lake. There was a woman who sent her dogs away, but kept her children and her father, who was on oxygen. We had a Red Cross shelter available that no one used. Employers didn't want their employees to leave. It fell flat. So what we learned from that is, even if it was, I think the right answer, like getting away from the smoke was the right answer, it wasn't necessarily the best answer for that community. The best answer turned out to be helping people shelter in place. And so that was when we started really frantically trying to get air cleaners with HEPA filters in them into the community. We got 25 right away to some clinic patients, and then the health clinic itself, because the nurses were sick, we needed to get air cleaners for that. And then we wanted to get some into the elementary school because we knew that it was still going to be smoky when school started, and we could see the smoke inside the classrooms. And this is where I ran into the problem of small communities. They don't make a lot of noise. We found that they suffered quietly through the smoke and didn't necessarily make a lot of noise and ask for help. So I was trying to ask for help for them and try to get money and funding. It was like this was a public health emergency, and I couldn't get money. I couldn't get the state to give us any money or to apply for FEMA money or take action. They just said, go and drain your own budget. So we did. We overdrew our budget and then had to go asking people for help. I mean, at my lowest moment, I emailed friends and asked for money. So that was a really significant challenge. But it was a very educational moment for us in that we can't react while the smoke is there. We have to plan ahead and also help the community plan ahead. I can't put HEPA air cleaners in every single classroom in my county. That would cost over $150,000 because, I have this small community of Seeley Lake that has like 2,000 people in one elementary school, and a small community of Condon. I was able to send 8 up to Condon, and then I was like, hey, all of your school children are protected. That's great. But in all of the city of Missoula, I have 77,000 people, and I can't just get them all air cleaners, which means we need to get to a point of people prepare for it on their own. We plan HVAC systems around the fact that wildfire smoke is going to happen. We build with the expectation that someday there will probably be an earthquake. I think we have enough life experience now that we should start building with the understanding that there is going to be wildfire smoke. And frankly, the technology exists to remove a lot of that smoke from the air. And so I think it's time that we start planning for that inevitability and have a way, just as we build buildings, to remove the particulate from the air with how we design HVAC systems. Until we get to that point, we're going to be constantly playing catch up and trying to throw Band-Aids at the solution, Band-Aids at the problem. But we need to get to a more of an institutional and policy and engineering place of control where we design buildings around the idea there's going to be wildfire smoke, and also the community members understand that they need to have some ownership of this and plan for wildfire smoke season like they plan for a hot summer. If you're going to have an air conditioner because it's hot outside, you should also get an air cleaner because it's going to be smoky. So this kind of varies on how really into air quality your community is. I think for the most part, they really just need to know the health category. A lot of folks, when they talk to me about air quality, they talk about the color coding of the air, like based on the EPA's nowcast. It was in the orange, or it went into the red. They aren't as interested in a specific number value. I really like giving people the concentration, the actual concentration of particulate matter, but I know that doesn't necessarily mean as much to them as it does to me. So I think that the health category of the smoke is more important than any actual numerical value. And then information about what to do when it's at that health category and what they should maybe be concerned about or what extra steps they should take. But I don't think you need to throw a lot of numbers out there, but you should make it available. They should have the option of finding the actual number. I can't stand when you hide numbers. I don't think people intentionally hide numbers, but if I can't get an actual concentration from an actual measurement, I get really frustrated. And that's something that I feel like should just be available. The data should be available, but the most important thing is that health category. And then also, like I said previously, you got to figure out how to get messages to the people that need it. And this is a challenge if there's not an air monitor in the area, where they aren't going to have a website, they can go and check their current air quality. So that is an extra issue where you need to, if there isn't an air quality monitor there, you need to have something that's very, very clear about how to use a visibility index. And then if you are, say, reporting about the air quality, but you're reporting from not that community and you're trying to get information to that community, figure out where they look for their information. It might be their local news outlet. Seeley Lake, Montana has a weekly paper with a really active Facebook page. So even if they only publish once a week, they have Facebook updates all the time, and if you get them your air quality information, that's where they can post it, and then people in the community pay attention to it. So really figure out where your messages will be absorbed.